Alright, so in this video we're going to talk about epinephrine and its uses in the ICU. So quick disclaimer, the information provided in this video is for educational and informational purposes only. I'm not providing medical advice, diagnosis, or treatment. Although I am a healthcare professional, this content should not be used as a substitute for professional medical advice from your own healthcare provider. So what is epinephrine? Epinephrine is a catecholamine and powerful vasopressor and inotrope. It has a couple different mechanisms of action depending upon the dosing. These mechanisms of action include it can be a alpha-1 adrenergic agonist, meaning it causes vasoconstriction, which increases systemic vascular resistance, also known as SVR, and blood pressure. It can also act as a beta-1 adrenergic agonist, enhancing heart rate and myocardial contractility, thus increasing cardiac output. And lastly, as a beta-2 adrenergic agonist, meaning it can cause bronchodilation as well as possibly reduce SVR. So the accumulation of these mechanisms of action are that it increases blood pressure and cardiac output and provides bronchodilation. So now let's look at some indications as well as dosing for epinephrine in the ICU. So one of the first reasons we would see epinephrine used in the ICU is for cardiac arrest. So it's used during CPR to improve myocardial and cerebral perfusion. It can also be used for hypotension in the ICU, and this might be considered when additional hemodynamic support is needed after norepinephrine, particularly when there is a need for inotropic support to increase cardiac output. It can also be used for anaphylaxis and severe asthma exacerbations. The dosing for epinephrine in the ICU, so for cardiac arrest, it's a IV push medication. It's 1 milligram every 3 to 5 minutes during CPR. As far as infusion is concerned, it is titrated dose via continuous IV infusion for severe hypotension. And this dosing typically starts around 0.01 to 0.5 microkilograms per kilogram per minute. So when using epinephrine in the ICU, what are some parameters that we want to monitor? So first and most importantly, we want to monitor their blood pressure, and we want to have continuous monitoring to assess response and adjust dosage. We also want to monitor their heart rate. We want regular checks for tachycardia or potential arrhythmias. We also want to monitor respiratory status. And monitoring is crucial for effects on breathing, especially when epinephrine is used in asthma. And lastly, we want to monitor for peripheral circulation. So regular assessments are important due to possible compromise from vasoconstriction. And this is why administration of epinephrine is preferable through a central line during continuous infusion to prevent extravasation. So what are some side effects we want to be on the lookout for when utilizing epinephrine in the ICU? So like stated previously, tachycardia and arrhythmias are both potential complications when using epinephrine. We also want to be on the lookout for hypertension, and this is because of a possible rise in blood pressure with its continuous use. Like stated previously, there's a risk for extravasation, so we want to be on the lookout for potential tissue damage if administered through a peripheral IV. And lastly, epinephrine has been known to cause anxiety and nervousness, and so we also want to be on the lookout for that and the treatment of that as well. So lastly, let's look at some important clinical considerations when utilizing epinephrine in the ICU. So we want to make sure that we're first addressing any underlying causes. So we want to address root causes of the patient's condition concurrently with epinephrine's use. We also want to assess for volume status to ensure adequate patient volume status before we even initiate epinephrine. And lastly, we want to have a gradual reduction. So we want to slowly decrease the infusion rate with continuous monitoring. So that is all for epinephrine. Thanks for watching, and please feel free to leave a comment with any suggestions of any future ICU medications or ICU devices you would like me to review. Thank you.